Malnutrition in the sick and elderly is a critical issue that demands greater attention. Researchers from Uppsala University and the University of Gothenburg have highlighted the severe consequences of malnutrition and the urgent need for effective interventions. Their findings, published in the New England Journal of Medicine, emphasize the importance of addressing this often overlooked problem. As many as half of all patients admitted to hospitals and other healthcare facilities are malnourished. This alarming statistic underscores the widespread nature of the issue. In Sweden alone, it is estimated that between 5 and 10% of all older adults are malnourished. This figure rises dramatically to up to 50% among patients in hospitals, nursing homes, or similar facilities. Traditionally, weight loss and malnutrition have been viewed as natural consequences of disease or aging. However, it is now recognized that underlying diseases often cause individuals to eat less, leading to malnutrition. The consequences of malnutrition are severe and far-reaching. Individuals suffering from malnutrition experience unnecessary suffering, poorer quality of life, and increased mortality. Malnutrition leads to weight loss and muscle atrophy, making it difficult for individuals to cope with everyday life. They become more susceptible to infections and require more intensive care, often involving long periods of hospitalization. The lack of nutrients can cause the breakdown of bodily organs and tissues, further exacerbating health issues and increasing the risk of mortality. Despite the severe consequences, malnutrition remains underdiagnosed and undertreated in healthcare and elderly care settings worldwide. Far too few patients are diagnosed with malnutrition, said Tommy Cederholm, professor of clinical nutrition at Uppsala University. Simple methods to diagnose and treat malnutrition are often overlooked, leading to continued suffering. The healthcare sector needs to make much greater use of the experience and knowledge revealed in recent research to address this issue effectively. Over the past 50 years, significant strides have been made in understanding malnutrition and how to treat it. There is now a global consensus among researchers and clinicians on the criteria for diagnosing malnutrition: weight loss, low body mass index, and reduced muscle mass in individuals with poor appetite, either with or without an underlying disease. Recent large-scale clinical studies have shown that malnutrition can be reversed. These are simple measures that are ignored every day, said Ingvar Boseus, a consultant at Sahlgrenska University Hospital. With the exception of those in the advanced stages of terminal illnesses, the vast majority of patients can be treated effectively. Effective interventions to address malnutrition include counseling and treatment in collaboration with dietitians and the use of nutritional drinks. These measures can slow weight loss and reduce mortality. It is crucial to register risk factors for malnutrition at an early stage and to be alert to weight loss and loss of appetite. Nutrient-dense foods should be recommended early, and nutritional therapy should begin in good time. This knowledge must become a much more explicit component of both basic and specialist training for doctors and nurses. The researchers propose concrete measures to reduce suffering among older adults. It is crucial to register risk factors for malnutrition at an early stage and to be alert to weight loss and loss of appetite, said Tommy Cederholm. By implementing these measures, healthcare providers can significantly improve the quality of life for the sick and elderly. Addressing malnutrition in the sick and elderly is not just a medical necessity, but a moral imperative. By paying greater attention to this issue and implementing simple, effective interventions, we can alleviate unnecessary suffering and improve the quality of life for countless individuals. The time to act is now.